You're tuned to Evergreen Media Network. I am Cindy Schwartz, and this is the Patient Partner Show. Today I'm by myself. Jeannie Roller is giving kudos and time air to the people that we have as guests today with a very important topic that Jeannie did bring to my attention, and sad and a lot of stories, but we want to get to the fact that people can heal themselves, and that's what we do, probably being our own best advocate in a lot of these situations. I know Jeannie and I talk about that all the time, but you need the information too. And there's going to be 3 ladies on. It's going to be one podcast after the other, so tune into all 3 of them. Today we have Dee HIcks. And Dee's story is that she got breast implants through elective surgery. Then she went with 54 symptoms all along, being told that it wasn't this, it wasn't that, it wasn't this, it wasn't that, and had explant surgery. They call that when the implants are taken out. It's called explant surgery, and Dee's going to explain a little bit more how sick she was. As soon as the implants were out, 45 of the 54 symptoms went immediately away. So, bravo for that, but all the horror that you had to go through, Dee, trying to figure all this stuff out. You also healed yourself by being your own advocate, and you also have talked in conjunction and still are with the FDA about why some of this stuff wasn't known to women beforehand. So, Dee, thank you for doing this. This is a big deal, and I'm totally with you. Jeannie is totally with you about being your own advocate. So let's tell your story. I want to cry every time I hear these stories.
Thank you so much, Cindy, first of all, for spreading awareness about this. It is a very important subject, and lots of women have breast implants, whether it be elective or post-mastectomy. A lot of women are sick, but me personally, like you said, I had, 54 symptoms. I'd gone to oncologists, infectious disease doctors. I'd seen almost a half a dozen or maybe a little bit more of medical professionals to try to get a diagnosis, only to be told that, it was more psychological, it was in my head, all my tests were normal or within range, and, you don't feel normal or within range, and women often fake that they're feeling okay. We don't fake when we're sick,
Right.
So, I came across a website when I was searching diligently, to try to figure out what was wrong, because the doctors were, everybody was, flabbergasted. They had no idea, baffled by what was going on. And then when I came across this website that said it could possibly be my breast implants, literally within 6 weeks of finding that website, I removed them.
Okay.
And so after I took them out, and, it's just not implant removal. It's also removal of the implants plus the scar tissue surrounding the implants. And it's very important that both the implants and the scar tissue surrounding them are removed at the same time, because for over 4 decades now, it's been, documented in medical journals about what's called a gel bleed. The shell of the implant breaks down over time, and that debris from it breaking down, it causes kind of like an oil slick, a highly toxic chemical oil slick that gets inside the scar tissue. So it's best to just remove the implant plus the scar tissue, because there's also a very aggressive cancer that's associated with the implants. Breast implant associated squamous cell carcinoma is one that comes inside the capsule. So it's really important that when women do seek to remove their implants, that it's not just going to the local plastic surgeon down the road to just remove them. You need to do it properly, so it's like one and done.
Okay. Get everything out now because you don't want to go back and revisit it. What kind of implants? Is it all implants? Is it certain, not name brand, but I mean, it's like you hear about silicone, you hear, oh, this is not silicone, this is blah, blah, blah. What kind?
Mine were saline, but just to be clear, all implants are made of silicone.
Okay.
Some are saline filled and some are silicone filled, but they all have a silicone shell.
Okay.
So the saline ones can make you just as sick as the silicone gel ones. I feel like the saline ones take a little bit longer for them to, the symptoms to kind of arise. I actually had mold inside of my implants as well.
Wow.
But the silicone itself is made up of over 40 heavy metals, chemicals, carcinogens. They're endocrine disruptors and cause immune system dysfunction. So immediately when we put these into our body, the body's like, hey, but what the heck is that? And, it creates this scar tissue around it to wall off and protect the body from the foreign objects. So, it's the studies that were provided for the FDA, a lot of them were done by the implant manufacturers themselves. And, that's what I think is a major problem in America in general is letting the people that are bringing their own devices to market, providing the safety studies,
Mm-hmm. Well,
after I was sick from my implants, I made a post on Facebook. It kind of went viral. And then I, became an advocate. I've been doing this for about 10 years. And I did speak at the FDA. And I helped get a certain type of breast implant recalled from the market and a black box warning issued for all breast implants. So I've kind of come full circle. Now I work for one of the top plastic surgeons in the world who specializes in the explant surgery. And so this is what I do all day, every day, is help women through the explant process.
Yeah, I mean, it's so sad. And I want to say the little bit of knowledge that I had about this before Jeannie brought it to my attention, I don't have a ton of it, but I mean, I'm getting more talking with you three ladies, is I thought saline ones were okay, but now you're saying that the outer shell with that is not. So who would think?
Yeah, and really what it comes down to, anything foreign in the body, whether it is a device, a medication, a vaccine, hardware, screws, plates, anything foreign has the ability to cause a reaction, in the chemical makeup of whatever it is that's been implanted.
Right. Well, that makes sense. We have like 3 minutes left, Dee, so I want to get to that doctor's name if you want to give that name. I want to also say that you are in Florida because all three ladies that I'm talking with are in different states. So this is nationwide. It's not just localized to any area. And I want you to give out your information on where people can get more, where women can get more, and men. I don't know if this affects men. Well, it does as their wives and whatever, where they can get more information to be their own advocate.
Absolutely.
I mean,
the doctor I work for is Dr. David Rankin, MD. He's based out of Jupiter, Florida. And my Instagram is Dee.HIcks.
So it's DEE.HICKS?
Yep. _explant_liaison.
Okay.
So that's my Instagram account. And Dr. Rankin's website is www.davidrankinmd.com. And that is his website if you wanted to put an inquiry in, or, I'm also on Facebook as well under Dee HIcks. So I get a lot of messages from women, husbands, brothers, for their sisters.
Oh, yeah.
So, absolutely.
Yeah.
And I really appreciate you having me on and spreading awareness about this. And if you ever want to do another call or have me on again, I would be more than welcome to.
Oh, no, we want to keep up on this because we talk about these things, and it's not to beat up on doctors in the medical system. I mean, I have so many doctors and they're phenomenal, but this needs to be talked about because it's part of the reason I say my opinion is all the information wasn't out there.
Right.
So how do you make the informed consent when all the information for the doctors, for the patients, for whatever, the brothers, the sisters, wives, husbands, whatever, you don't have all the information. You got one hand tied behind your back trying to figure this stuff out, and you're thinking you're doing okay. Right. And there's the trust factor. We talked about that all the time. I will post you and I will be in contact continually. I will post your information on the different podcasts so people can look up under the descriptions and stuff to get that too. So don't worry about that if we did that too fast for the listeners to understand. I'll definitely put that on the podcast, and it's on Spreaker, it's on iHeart Talk Radio around the world. So it's a good subject. I really appreciate you on for the last 30 seconds that we have. Dee, what's one thing that you would tell women to be mindful of with what you've gone through?
Nobody escapes the wrath of anything foreign in the body. So if you have unexplained symptoms, food intolerance, skin rashes, brain fog, I highly recommend looking into breast implant illness.
Okay.
Because it's usually the root cause of many of the ailments.
Okay. On that note, stay listening to Evergreen Media Network.